Hello again, Amy Stein from Beyond Basics Physical Therapy, and I have Dr. Robert Graziano with me again. Hopefully you got a chance to look at our first series on our social media at Beyond Basics PT, and we will be posting it onto our website as well. I had the opportunity of already speaking to Dr. Rob about his journey with pelvic pain, and I'd like for him, if it's okay, to describe the symptoms again for our listeners, and then also go into your journey with the actual treatment, what that entailed, and how you felt you benefited from it.
Okay. Well, again, I had severe penile pain, and it was just burning along the dorsum, the back of the penis, and it was just unrelenting pain that did not stop no matter what I did. I took medications, everything, nothing would alleviate it. And the only thing that made it better was going to sleep at night and waking up in the morning. That was it, and then I was back to square one again. So what I did was I saw Dr. Pintari, who happens to be one of the 3 leading people in the entire world in this subject, and he recommended that I take some pain medication, but it was very low dose, but to exercise and to get physical therapy. And you can actually look it up on YouTube, and he has a video under chronic pelvic pain, Dr. Pintari, and he mentions in the video that the greatest advance in the last 10 to 15 years has been physical therapy. It's been shown to benefit patients. The thing for me was trying to find a good physical therapist, and I'd asked him, did he know of anybody where I lived, and he didn't. He knew of some in the Philadelphia area, so I had to do my own homework. And I did find one that she was very good, and she took me on as a patient, and she gave me some physical therapy, and I did make some strides, and I felt a little bit better, but she only did basically external work, and it's a combination. I actually had looked at Amy's book and her video and found out that I needed more than the traditional external physical therapy. So then I had to find a physical therapist that dealt more with that. So again, I did a little bit of homework, and I spoke to one of the urologists I know, and he recommended me to go to a woman outside of Philadelphia, affiliated with the University of Pennsylvania, and I went and made an appointment with her, and she gave me some more internal work, which I knew that I needed to get better. And again, I made stepwise improvement, but at that point, I wasn't getting much better. So I decided that I found out that Amy had her own facility in New York, and I figured, well, I'd read her books and watched her DVD, why not come up here? And I made an appointment, and I came up one day, and I actually got a very good examination, detailed examination, physical therapy. It was about an hour or so. And I went home that night, and that was the first time that I actually didn't have much symptoms. So I knew that there was a lot of hope that I could get better. So, I knew that there was an end game. I had read some articles where people felt like, they're never going to get better. But I was given hope. And that's the thing that you look for, is that you know that there's something out there that's going to help you.
So basically, the physical therapy, just so the listeners understand, consisted of external, internal manual therapy techniques. Also, was there some behavioral modifications? I know some people benefit from, and it may not have been in your case, but some people benefit from cushions, some people benefit from using biofeedback. We also just do manual biofeedback with the feel of the muscles and what's going on. We do have a machine, but we find that just doing manual biofeedback can be just as effective. And also other things that we do are like postural re-education, learning how to relax the muscles. That you may have gotten from my book, probably, because that's the one thing I'm like, if there's one thing you should be doing right away, is the breathing technique, trying to relax your whole nervous system, as well as trying to relax the pelvic floor by doing pelvic floor drops or relaxation. It's hard to describe, but I do describe it in my book, Heal Pelvic Pain. So was that about, would you say,
Yeah,
just for our listeners?
I did get a lot from your book. First of all, once you become educated, you feel more at ease, and there's a lot of exercises too in the book.
Yep.
You know, that I should point out that I did those at home as well, just to stretch your pelvic floor, and they say to relax it. So I did all the breathing exercises. I did everything I tried in the book, because you want to do something that's going to make yourself better. You want to feel you're doing something. If you're not doing something, it's just on your mind the whole time.
Right.
So there are a lot of things. Briefly, and you're the expert in this, but there's more to healing than just physical therapy. Like you
Right.
said, there's exercises, there's breathing, and there's a lot of different things that can help you.
Yeah. Was there, 2 questions. Was there a medication that helped? And also, what other things would you describe? Like, did you do like yoga or mindfulness practices? What seemed to help you?
Well, as people find out, if you read about chronic pelvic pain, again, you're the expert, but it's multidisciplinary. There's not just one magic pill, not a medication that's going to make it better. I think you got to look at everything. I actually went to a meeting on pelvic pain, and they described how the brain is oversensitized to pain. So although your pain may be here, your brain's feeling it at that level. So I did take a medication. I met with a psychiatrist. I am the least depressive person you'll ever meet, so I didn't need it for being depressed, but to lower that pain. So I was put on medication. For me, it was Cymbalta. There's a lot of one, nortriptyline, I think, and some other ones. But so I did the medication. I did the physical therapy. I did go to the gym. That was one thing that Dr. Matari emphasized to me, even to alleviate the stress. And they even talk about, not to get too much into it, but to even do resistance training and aerobic, not just one, to do a whole bunch of different exercises. So I did this, and then finally, towards the end of my journey, this was later on, but I did mindfulness. I mean, you know, a lot of men don't do that, but I actually went to a course. And if you're in a lot of pain, these are all you want a lot of tools, and you want to have things that you can rely upon. And that was the thing. I wanted to optimize how I could get better. So I was figuring if I had 5 different tools, that would make me feel better, and it did.
Oh, great. Great. So thank you. That was the end of our series 2 of our pelvic pain videos with Dr. Graziano. Stay tuned for more. Thank you for listening.